Welcome, everyone, and thank you for joining our webinar today with our partner, MediMobile, Unlocking Revenue with AI in Medical Coding. We're excited to have you with us. We'll get started in just about a minute as we wait for our attendees to join.
This is where you cue the groovy music. What music would we play right here? What's popular?
80s alt. Okay, I see people coming in. We'll give about another 30 seconds and I'll turn it over.
Maybe Taylor Swift. I don't know. That's what I keep hearing.
Okay. Great. Let's continue quickly with a few housekeeping items. Today will be a very interactive format. We welcome all of your questions. Please type them into the Q&A chat throughout the session. And if we run out of time, we definitely will follow up with you directly after the webinar. We will also be sending out a link to today's webinar replay. Please feel free to share that with your colleagues. I will now turn it over to James Muir, who is Unislink SVP of Sales for the remainder of the webinar. Thanks, James.
Well, yeah, thank you, Gina. And we're really excited to be talking about a topic that is easily the hottest topic in many years in healthcare, and that is artificial intelligence, specifically AI coding. And to educate us on that, I am excited to be talking with one of the biggest experts I know on this topic, and that is Lauren Hall, who's a director at MediMobile. Lauren serves as MediMobile's Director of Business Development and Account Management. Her roots are in implementation and account management. And so she knows all there is to know about working in the trenches with clients. And that's been my experience with her since we started working with MediMobile. And believe me, she is always helping clients, whether that's improving efficiency or boosting revenue or whatever it is. So Lauren, thank you so much for joining us and being willing to educate us a little bit this morning on AI.
James, thank you so much for having me. MediMobile appreciates the partnership with Unislink, and we're excited to talk with y'all today about our AI coding. Let's first start off with a poll to see who we have with us today. What is your practice's biggest challenge with medical coding? Accuracy and compliance, taking too much time, coding errors that result in lost revenue, or staffing or coder shortage?
No, I would say they're all big challenges right now.
So, I would agree.
Yeah, I will be interested to see what ends up being number one in this poll. If I had to guess, I'll bet it's the bottom one. I'll bet it's staffing and coding shortage. We'll see.
We hear a lot about the lost revenue, which is what we are trying to solve along with Unislink, finding all the revenue possible.
Yeah. Next time we'll do a stacked rank one so that they can pick each one.
Yeah.
Looks like about half the folks have completed the survey.
Okay.
All right. So Lauren's betting on number 3, and I'm betting on number 4.
So I'm going to go ahead and end the poll here. It looks like, oh, we just got another one. Does everybody want to get their last minute vote in?
You snooze, you lose.
Okay, I'm going to go ahead and hit end. There you go.
Okay, now will we get a display of that results, or do you need to tell us what you see on your side?
Oh, you can't see that. I'm sorry. Yes, let me help you with that. So out of, looks like 50% of the people that took the poll said coding errors that result in lost revenue. And then it was a 25-25 split, 25% split between staffing or coder shortage and taking too much time.
Okay, you win, Lauren. You win. All right. Well, that'll give us a little context, and we'll try to adapt this to that. So we'll talk a little bit maybe more about the return on investment part of the AI coding. So you've been with MediMobile a long time, but AI coding is kind of a relatively new concept. Everybody's excited about it. Maybe you could lay down the groundwork a little bit for us by sharing, what is automated AI coding, and maybe about how it came at MediMobile, because I know you guys originally originated as a sort of a charge capture solution.
Yes. So our automated coding came because we saw the need for the automated coding from the denials that some of our customers were seeing and the inaccuracies that the coding that was being entered had. So with that need, what our development team began working on was the autonomous coding that is available for customers now. So ultimately, that need is where this originated, and we're excited to show it to our customers. We have people utilizing it today. And just a little background about MediMobile, we have been around for over 20 years. So we like to think of ourselves as experts in not only charge capture, but increasing and capturing any revenue that should be coming through for the practice. So our long relationships with our customers have proven that success rate. And then what we hope to see moving forward with this new launch of our AI is the continued success and increased revenue for those customers.
How long has the AI coding been a component of MediMobile? I know it's just relatively new in the last few years, right? A couple years?
Yes, it actually became available for customers right around this time last year. We have been testing it for a few years now, but it was officially available to our customers as of November of last year.
Well, very exciting. We have several clients using it. Well, tell us a little bit about how the magic works, right? And maybe since we're at the beginning here, for those that aren't familiar with the whole coding process, maybe you could walk us through how the AI coding works from a clinician's perspective.
Absolutely. So when providers create medical documentation within the hospital's EMR, we then receive that feed. It's called an MDM feed. That is the medical documentation, the notes that the providers, again, are creating within the EMR. That information flows into our system, and that's when the AI magic begins. Our system reads the documentation the providers have created, and we add CPT and diagnosis codes to those charges, eliminating that piece from providers. The other very exciting piece with our AI is the addition of modifiers as well as MIPS measures. So if these items are being documented through the provider's documentation in the EMR, our system will catch them and add those modifiers as well as those MIPS measures.
All right. Well, I may ask you some questions about MIPS, but I don't want to get sidetracked here. So tell us that since that's from the clinician perspective, how does the whole coding thing work for billers, right, and other coders? And I know our billers love it, but maybe give us a little, so we see the physician's perspective on this. What's it look like for the folks that are doing the billing side?
So we have two options. So the providers can approve the CPT and diagnosis codes that we have assigned based off of the documentation, or we can turn on what's called pass-through, where everything flows directly over to the billers and coders with those assigned CPT and diagnosis codes. And what we see is an increased efficiency for your billers and coders. So your billers and coders are able to spend more time on those complex cases, and then resources can be reallocated in different ways because not nearly as much time is spent adding or correcting CPT and diagnosis codes. This accuracy that is coming through in real time allows your organizations to get those bills out much faster because your billers and coders are not having to go through and review documentation.
Yeah, that's right. Our experience has been that when we get a charge, we run some edits against it. And if it fails one of those edits, then a whole new process of correcting that error has to be done. If it comes to us cleaner, then of course we're dodging all of that, right? but maybe address this. Oh, did you want to add something there?
Yes. So one thing that we do is we work with our customers to identify any nuances, maybe specific to their practices, to ensure that our AI coding is accounting for those. So if maybe a practice is really struggling with the level of coding for critical care, we'll talk through that with the customers to ensure that those items are being identified.
Okay. Is that all part of the implementation process?
Absolutely. And
okay.
It's ongoing. So we continue to communicate with our customers to ensure the highest level of satisfaction, as well as the highest level of documentation for those providers to decrease denials.
Okay, I have some thoughts about that, but I'm going to wait till we talk more about that when we get into the details of it. So since we're talking about people's perspective, everybody's worried that AI is going to take their jobs, right? In fact, I was going to ask you guys, does your AI have a name? They all seem to have female names. My wife thinks that all AIs are named after women because they're never wrong. That's her stance.
So this is actually really exciting. We are just now announcing the name of our AI. We actually had a competition that was sent out internally to the employees at MediMobile to name the AI. And Amelia Young, one of our account managers, actually came up with the perfect name. Our AI is called Genesis, because this is a new era of MediMobile. We're taking our customers with us to the forefront of technology with this autonomous coding. So the name is Genesis.
Very, very cool. Very a beginning type of a theme there. Yeah.
Yes.
All right. Well, so is it going to replace everybody's job, or how does it end up affecting different people's work? We just saw how it affects our billers, right? It actually helps my people out. But how does it, what about this fear that everybody has?
So I hear that fear. The good thing is what this does for your providers is it frees them up to spend more time with their patients, or maybe get home a little bit earlier or see more patients. For your billers and coders, it allows them to focus on more complex cases and also just reallocate their time. So the goal with the AI is that we work with the billers and coders as well as the providers, not to replace people, but to provide more time for different actions within the practice.
Gotcha. So they're focusing on different stuff.
Yes.
Probably the biggest question I get, Lauren, is people just ask me, well, how good is it? Right? They ask me how accurate it is. So can you give us a sense of how artificial intelligence improves accuracy of the coding, right? And what kind of accuracy rates can a client expect to see?
So we're very, very proud of our 95% accuracy rating. Our engineering and development teams have been working years to achieve that level of accuracy. We're very, very proud of it. One of our executives, their focus is, where are we missing the mark? Because we want to be as close to perfect as possible. So right now we are at a 95% accuracy rate.
Gotcha. What about complex stuff, like really narrow subspecialties and things like that? Can it deal with those kinds of things?
Absolutely. So what we do, once the integrations are in place, which are those feeds from the hospital, our system reviews the documentation for a period of time. And then if our team has any questions, we reach out to the practice or the representative. In this case, we would reach out to Unislink for those customers, just to discuss anything we're seeing or we're unsure of, because obviously the goal is that increased efficiency through the accuracy. So any questions we may have, we will reach out. But as it stands right now, that system has proven that 95% accuracy rate. And we do tailor our AI towards every specialty. And we have identified, for example, we have a radiology group that documentation was being created with a few different document types where we were seeing information in different fields. So our team was able to go back and just discuss that with the practice to ensure that the results that were being returned were what they were expecting, which they were.
Gotcha. Well, some of our clients have seen a revenue bump, which is got my attention, right? Is probably the reason that we were having this webinar today. So do we have enough experience under our belt to know what kind of impact AI coding typically has on, either hospital or practices of revenue?
Yes, so we're confident in saying that practices will see a 15 to 20% increase, and that comes from not only the coding accuracy, but also the decrease in denials that practices were seeing prior to because of the lack of accurate documentation. So right now we're sitting at about 15 to 20% increase.
Okay, so part of that's denial management. Is any of that due to inappropriate E&M where they're getting the wrong level?
Yes.
Okay.
Yes, absolutely. So a lot of that increase, aside from those denials, does have to do with the coding levels. So what our system does is it reads through the documentation to ensure the highest level of coding is provided. And we also, if the providers or the billers or coders are interacting with the system, we identify if there's further specifications that can be made just based off of the verbiage within the documentation. So the providers can even go back and amend the documents, and in real time, we will recode, but we will pull out different elements of the documentation to ensure that the highest level of coding is provided.
Gotcha. How long does it take? Like, when are the clients most likely to see a bump in their revenue?
It's typically 1 to 3 months. It's very fast. So we know that when a practice maybe switches from one charge capture platform to another, that ROI is not always realized so quickly. But with the autonomous coding, we are seeing it within 1 to 3 months, that increase in revenue that we just discussed. And again, that's just due to the accuracy as well as the decrease in denials. The reduced time that your billers and coders are spending on coding, they're able to process more claims faster. So there are a few different elements that go into that revenue increase, but the root of it is the AI.
Okay. So just and we are starting to get questions in here. So we're going to save some of those towards the end. But just to get selfish for a minute, what are some of the more tangible benefits that users see? I think you just summarized a few of those. That, what do they typically see after they've integrated into their practice?
So you're going to see a reduced operational cost. Your teams are able to, again, allocate their resources in different ways. Of course, that really fast return in revenue, that 1 to 3 months, that's instant growth right there. Now, your providers, and this is one that kind of knocks the socks off of providers, they're saving between 10 to 20 hours a week because they're no longer having to enter those CPT and diagnosis codes. Some of our providers are even, looking up, they are very thorough, so they'll go research, what is the best code for this, but we're eliminating that. Our goal is to eliminate charge capture completely from the provider workflow and just ensure that those accurate CPT diagnosis codes, modifiers, MIPS measures, everything is passed to your billers and coders to provide them with more time as well, because they're not having to do the research through the documentation.
Yeah, would you throw reconciliation on here? Charge reconciliation, so some of the groups we worked, especially hospital-based ones, they're doing when they're independent, they're doing all kinds of crazy things to capture the charge. Like, they're taking pictures of face sheets, or they're writing them, or some of them actually enter them into a spreadsheet, and then later they're sent somewhere else to get entered in. Would you throw reconciliation here as one of the things that is a sort of an operational benefit?
Absolutely. So one thing that sets MediMobile apart from other solutions is the integration of the medical documentation feeds. So prior to our AI, we were actually taking the medical documentation feeds, the provider's notes that are created within the EMR, and using those to populate patients, ensuring that all billable encounters are billed out by providers. So that was prior to the launch of the AI. What that does is that ensures that every billable event is accounted for. So reconciliation has always been a very important feature of MediMobile, especially with the use of those MDM feeds. But now with the AI, not only are you accounting for every billable encounter that you have, but you're also ensuring that the coding is at the highest level possible to ensure you're receiving the highest level of revenue.
Yeah, and I noticed you didn't put charge lag on here, but that's another thing that we often see with at least the hospital-based specialties is there's a period of time between when they actually saw the patient and when the service actually gets, entered in, and then of course the claim goes out after that. Can you speak to that a little bit?
Absolutely. So we receive the documentation in real time. Our system codes it in real time. So it then is sent over to the billers and coders in our charge review platform, and they're actually able to get claims out we're seeing within that 24 to 48 hour window, which means more claims are being processed faster. So again, that's just another way that revenue is increased.
Yeah, and the way we would see that in a KPI is known as AR days, accounts receivable days, but it's a metric of cash flow. And that's some of the things that we've noticed from our clients is that when we shorten the charge lag, of course, it improves the cash flow by the same number of days. So the sooner we get in, the better. All right, let me ask a harder question. So what about audits? I know that's everybody's favorite topic, but is there any way that the AI can help with audits?
Absolutely. So just depending on exactly what you're looking at, we have audit ready documentation. So the codes everything is coming in real time. So if a provider were to go in and make an update to a document, as long as that hasn't been billed out yet, when we receive that, it will update the coding as well. So just again, that real time piece is very important. It keeps all those audits accurate. So we also, with our AI, we have various reports, as we call them widgets. When providers log into our platform, they have widgets where they can actually monitor what is going out, what codes are going out, RVUs even. So those audits are right at their fingertips for a quick glance, but we also have a very robust reporting system that allows for tracking everything. Another important thing to note about MediMobile is obviously we know that codes change from year to year, and those updates are made immediately into our system, but we do allow, of course, for back billing, where anything that needed to be coded using retired codes, they can be coded out prior to the date of the retirement of the code. And the way that we do that is we have rules that we put in place where if a provider or a biller or a coder tries to use a retired code for a date of service past that retirement date, a notification will pop up just letting them know that they need to amend that code.
Dynamite. All right. Well, I know your roots are in implementation, right? So let's see if we can answer some questions about how we make all of this work. So tell me, what are the things that go wrong? What are the biggest challenges that folks face when they're, or things they need to look out for when they're transitioning to any kind of automated coding here? I mean, what can go wrong and how do they avoid that stuff?
So what we want to do, and we're very, very grateful for Unisys partnership. The AI is dependent on obtaining the ADT and MDM feeds. So the admit discharge transfer, which are those patient demographic with insurance information feeds, and then the MDM feeds, which include the medical documentation for the providers. So it's important that as soon as we sign with a customer that we begin that process of requesting those feeds. We have relationships with facilities all over the country, so it's typically a seamless process, but the sooner we engage with that, the better. That way providers are not having to manually create patients, take pictures of face sheets. Everything flows into our system through those feeds. So that is the most important part in getting the AI started, are obtaining the feeds from the facility. It's important to know also that MediMobile now integrates with point-click care, a system I'm sure Unislink is very familiar with. And we are actually working on the AI for the documentation that flows in to point-click care. So, but again, it requires those feeds, which we are very grateful to point-click care that we've been able to integrate with them as well.
So what's the dynamic around those feeds? I know you can do the integrations, but is it that we have to deal with the IT department at a facility, and sometimes that ends up being a constraint on getting them set up?
So the amazing thing is, the customers do not have to work with the IT departments at the facilities. Typically, the initial request does involve the customer just because it's their data. After that, MediMobile, we have a wonderful dedicated integrations team that actually handles absolutely everything to do with the integrations. So the customers, or in Unislink's case, it's just that initial introduction and request for the data to be sent to MediMobile. After that, our integrations team handles everything. It typically involves security forms, VPN tunnels being set up, and our integrations team is probably just cringing as I say these things. But after that, they take care of the technical pieces and the magic happens. So it's really great for the customers, but that is by far the most important part to get the AI going.
Because it's and happens soon because it's a constraint, right?
Yes.
Yeah.
Yes. So what we typically see is facilities will provide that ADT, the admit discharge transfer feed. It's just a bit easier, it seems, to get to us a little bit faster. So we can always customers can start manually if they want to, and then with that ADT feed, their patients will automatically populate to their list, and then pretty quickly after that, we get the medical documentation, which they have access to on their mobile device, on the web, and then within about 30 to 60 days, that's about the length of time that it takes our system to train on the documents, then we can turn the AI on.
Okay, so that kind of gets me to my next question, which is about how, probably the second most common question I hear is, how hard is it, or how easy is it to get started? So maybe you can speak, to how well automated medical coding integrates with the various different EMRs that are out there, and just the key things that they need to think about.
Yes, so it's important to remember that our AI does require that MDM feed. So we typically only see those from hospital systems. Like I said, with point-click care, we are actually able to obtain the medical documentation feed in the cases of those post-acute facilities. Now, we will work with any integration team if they're willing to work with us. We've had cases in rural areas where their integrations team had never set up an integration, so our integrations team walked them through the process. So it's not to say that at a post-acute facility that it's impossible, it's just that they have to have those medical documentation feeds available. But like I said, our integrations team is more than willing to help another team walk through that process if they're unfamiliar.
Okay,
so
go ahead. Do they just start the process? Is that what happens? I mean, the provider or the administrator only needs to sort of get the ball rolling, and then you guys take it from there. Is that what happens?
Yes, and we provide the template to reach out. We'll also provide the contacts. There are some cases where maybe a provider actually has a better contact, an in, if you will, that's helpful, that speeds things up. But we provide the template that is sent via email to the facilities, and we're typically CC'd on that email so we can take over seamlessly.
Okay, so you just mentioned how long it takes the AI to learn. But how long does it typically take to set somebody up? Like, let's just say brand new, they have maybe just one facility, but maybe they have, half a dozen facilities that they need to get feeds from.
Yeah.
Help me understand the time frame for that.
So we require 30 days to set up a group. Now, depending on the facility determines the length of time it takes to get those feeds. But like I said, we have relationships with quite a few facilities all over the country. So that can be pretty quick. In expedited situations, we can move faster than that 30 days, but the 30 days is our standard to set a group up and get them going on MediMobile. That is with feeds that are ready to go, ready to be pointed. And then, of course, if the customer does want that AI, as soon as we have those medical documentation feeds, it takes about 30 to 60 days for our system to learn them. Now, what we are seeing is it's actually going a bit faster now, especially with E&M. So we're going to say 30 to 60 days, so nobody's disappointed. But of course, if it is ready ahead of time, then we'll notify the customers and go ahead and turn it on earlier.
All right, so let me see if I can get all these pieces together in my mind. So we've got the lead time of getting the feeds, and then there's the time it takes the AI to. So are they able to use it just for charge capture purposes during the initial period before the AI is turned on? They can still use the app, right?
Absolutely. And that's what the majority of the customers do. They will go live either manually or with the ADT only within that initial 30-day period. So as soon as, a contract is signed or Unislink notifies us of a new customer, we can get them live 30 days or under. And in that period of time, like I said, the patients can populate off of that ADT only, or they can be created manually and face sheets uploaded. I do want to note that even in that manual process, with our mobile device, the providers are able to actually take pictures of the face sheet. It doesn't store them to their phone, but it will attach it to the actual patient information within the system, which makes it really easy for billers and coders to pick up.
I gotcha. So our team would then do charge entry off of that photo. Yeah. Okay. All right. Well, up to this point, we've kind of talked pretty generically about, AI coding and all that. So maybe tell us, give us a little bit about what makes MediMobile different or stand out. I mean, I know there are a number of vendors out there, but honestly, the ones that exactly in your space are pretty limited. It's maybe 3 or 4. So how does MediMobile stand out in that whole world of medical coding solutions?
So, I feel like there's so many reasons, but of course our accuracy rate does stand out amongst our competitors. When we look at other coding solutions, that accuracy rate is significantly lower. Like I said, our team spent many, many years getting ready to launch this. We also actually have coders that are reviewing things because we do, we understand that human component. That's very important. So we actually have billers and coders on our staff that are reviewing everything. The other thing is the feedback loop to the customer. So like I said, we take a look at the documentation, and if we see areas for potential improvement, not only do we have the charge grid available to the providers and the billers and coders where they can take the information back to the providers, or the providers can see it right there in their hands, but we also set up meetings as often as the customer allows to identify those areas where documentation can be improved to decrease those denials, or we can even implement what are called smart phrases. So if you have providers that really struggle to document for certain specialties, we can apply smart phrases that assist with that coding if the documentation just isn't there, more than likely due to just time.
Okay, yeah, that brings me to this question. Like, let's say that their note that they've documented in the facilities EHR is not complete enough to actually do coding off of. What would the provider see?
So the provider will see and I'll show you here in a second if we have time. It's a red triangle on the actual patient chart, and it just shows that there's not sufficient information to code. So the provider, that should trigger the provider to go back into the EMR and add additional documentation, which we'll take a look at here shortly. And what will happen is that amended documentation will flow over in real time and we'll code. But the bigger piece there is when we start to see those patterns, we reach out to the customer immediately to say, hey, this is what we're seeing. And in order to ensure that your workflow is efficient as possible, these few items would help increase that.
Okay, well, since you volunteered it, I think we have time Do you want to just show us the app for a minute? I mean, several people have already asked how they can get a demo. Maybe we could just take a couple of minutes and you could give them some high-level exposure
Sure.
to what it looks like. I don't know if you can share your screen, but
Absolutely.
if you've got something ready to show, I think that'd be our attendees will get some value out of that.
Okay, so what you see right here is the home screen. So when a provider logs into MediMobile, this is what they will see. The two most important widgets that we'll talk about today are going to be the active list widget as well as the active list confirmed versus unconfirmed widget. So what you see with this active list widget is the patients will load for today's date of service. It will default to today. And then underneath that, you'll see the incomplete from previous days. So if a provider does his or her documentation, but doesn't bill for 2 or 3 days, those encounters will be loaded in this incomplete from previous days, which I'll just click on. And you are able to see those. Let's see.
When you're not doing a webinar.
Yes, of course.
And what are the load times and what devices can they use it on? I notice you're using a PC right now.
Yes, so you can use the web. I may need to reload it. I've had it sitting here. I was excited to show everybody. So let me log out and let me log back in.
For example, could they use their phone or could they use an iPad?
Absolutely. iPads, tablets, iPhones, Androids, just about any device. And it all depends on just preference. We do have a lot of providers that prefer to utilize their mobile devices. And then we have some that prefer to use the web. Let me share my screen again. Let's try this one more time. Sorry about that.
Okay.
Okay.
I appreciate you letting go off script a little bit.
Yeah. Well, no, thank you. So this is the web version right here. So what you see with Sophia Davis, you can see that the patient populated, we have all of the information that came over from the feed from the hospital. You also actually have access to the document. So by clicking right here, you can see the document, and you'll have to forgive me. I have my screen. The way that I have my screen is making it small. But you'll also see we've added the CPT codes, we've added the modifiers that have all been located within the documentation. So like when you were asking about a lack of information within the documentation, so this right here, this T78.2XXA diagnosis code, this requires refinement. There's just not enough information. So this is telling the provider to go it's suggesting
add more detail into the medical record.
Yes. Now, a provider does have the ability, if they disagree and they say, I just don't want that there, they can absolutely remove it. Or if they want to resort the order, they can do that as well. And then this unspecified. So this is just indicating to the provider that more specification is possible for this particular diagnosis code, meaning they could add additional specification within their documentation. We also have our refinement tool, which is available on all of our platforms, whether you use AI or not. If a provider enters a diagnosis code that allows for refinement, those will pop out right here. So the provider does have access to go ahead and refine, and you'll see that it went from orange to green right there.
And let me just throw something in here from the billing side. That refinement, if you're doing any kind of full risk, or you're doing anything with Medicare Advantage patients, all of those things, the higher level specificity on the ICD-10 affects what's called your RAF score, which is a risk adjustment factor, and it literally affects how well you get paid. And so it can make a very big difference, helping have the computer, help you identify a more specific diagnosis based on the note that you've got in there.
Well, and just to add to that, James, our customers, whether they use the AI or not, that refinement tool, it's very, very helpful for them. Just like you said, a provider might pick a diagnosis code, but there's additional refinement options that improve that return. So that is available both with the AI and without. I do want to bring your attention down here to the scoring guidelines. So this is just indicating some areas of improvement based off of this documentation. And so this is available not only to the providers, but also to the administrative team, as well as the billers and coders, because those instances where we have pass-through turned on, where the providers are not actually interacting with MediMobile, it's your billers and coders, they need to have that access so they can go back to their providers and say, hey, this is what we're seeing in documentation. Let's return all items. So with these from the provider side, if a provider agrees with the codes, they can just hit approve bill. And then every bill
just to break in really quickly,
the billers that are they're able to process.
Lauren, you're breaking up a little bit, just FYI.
Uh-oh. Okay. Is that better?
Yeah, maybe just summarize. I think you just cut out a little bit there when they review and then they commit, right?
Yes. So once they click that approve bill button, the encounter actually goes over to the billers and coders into our charge review platform, where they're able to review everything and go ahead and send it out to the billing system.
Gotcha. That's when my team gets it, right? Usually.
Yes.
Yes.
Yeah.
All right. And I noticed this one got the CPT correct, and then it's really helping more on the DX side.
Yes. Yes.
Okay. What else should we be looking at in here to help others? I'll look at the quote. We've already gotten half a dozen questions, so let me just see if any of them are immediately relevant here.
And James, while you're looking at that, this piece right here, so while the team is waiting for the AI to learn the documentation, this is what the customers would see if they did want it to go live before the AI is ready. The patients would populate to their list. They would still have access to that medical documentation. They would just click on that hyperlink right there and they could view it. And then they can go ahead and enter their CPT and diagnosis codes. We have the ability to add custom code lists. So, if you have providers that are only using a certain set of codes, we can load those to make it a bit easier. But the providers can absolutely enter the CPT code or the description, as well as the diagnosis code or description. And that will load right here and they can select that.
Wonderful. All right. Well, one of the questions, we'll boost it to the top of the queue here, was about the diagnosis that we were talking about and picking a higher level HCC in the diagnosis, the ICD-10. And his question really wasn't how it worked, but so much, have you seen, and this might be, maybe it's new enough that you don't have data, but his question is, do you have any percentage increases year over year that you've noticed? Have you had any clients report a boost in their RAF score because of using MediMobile? Hopefully I said that right, Jack.
So, are y'all able to hear me?
We can hear you.
Okay.
Yep.
Okay, so like I said, we launched this to our customers last year, so we are gathering that data still. And that will be something that we would provide probably in the next couple of months, what those statistics look like for those increases. That I can tell you that our customers that are using it are reporting that 15 to 20% increase in revenue. But in terms of that upcoding that you're asking for, that would be something that we could provide just a bit later. We're gathering all that.
All right, so but let me, for the rest of the group, in case you're not familiar with how HCC coding works and RAF scores, is most of your managed Medicaid and your MA plans are all using these RAF scores, where the diagnosis code, the ICD-10, it has this thing called the HCC, and the higher you pick, the sicker your patient shows to them, and it means you get a greater percentage of the risk pool. And so it makes a big difference. And you don't, if there's let's just say there's 35,000 lives or something like that, you don't have to move that dial very far. Just a 1% change can make a huge difference in revenue for the practice. So having a tool that will help you pick a higher HCC can end up swinging thousands and thousands of dollars, just because you're getting the coding right. So having a tool help you. So we'll commit you to another webinar in 2025 when we've got some data. But we'd be really interested in seeing that, because that's a huge factor for a lot of groups that are taking on risk or see a lot of MA patients or a lot of managed Medicaid.
Absolutely. I look forward to it.
All right, so let me go through the questions here. I think we've got, and Gina, you're welcome to go through it if you can see them easier than I can.
Sure. I just was going to give you guys a time check too. There were a few more questions in the chat, but I know there's, I'm not sure where you are, James.
Yeah, so one of them, they're asking, obviously, Lauren, is they want to know how much it is. And so you don't necessarily have to tell them the price. They can talk to someone for that, but maybe tell us the model. Is it charged on a per provider basis, or are you charging a percentage of revenue, or how does that typically work?
It is a monthly subscription price. And the nice thing is, so like we talked about, it takes a time for the AI to ramp up. So we have a tiered pricing structure based off of the platform that you're utilizing. So for the providers that decide to go live prior to the AI, it is a lower pricing tier while they wait for the AI, but it is a monthly subscription fee.
Okay, good question. And I got a question here. What happens if the patient that they are seeing is not one that came over in the feed? Does that happen?
Okay, so when populating off of the ADT feed, this is actually interesting because we were meeting with a facility about feeds yesterday. And they are very aware that if a provider is not listed in specific fields in an ADT feed, that patient may not come over to MediMobile. In that case, and we're talking strictly about an ADT feed, a patient can be searched for and then added to the list. The reason why we find the medical documentation feed to be more accurate is because if a provider creates a document for a patient, it's going to populate to MediMobile because it is based off of the provider either starting or signing the document. That's where that increased accuracy and that insurance that every billable encounter a provider is performing is accounted for. So we do have insurance. In the case of a group that's populating off of ADT, if a provider is not listed where expected, that patient can either be manually created or you can search for that patient and add that patient from the feed into your patient list at MediMobile. But again, we recommend that medical documentation feed. We have large and small customers both that have seen significant increases in revenue and improved reconciliation because we are accounting for every single billable encounter.
Okay, so we've got, I think, almost 3 questions here related to size of practice. So let's just see if we can burn through these. So this group says, we're in Rhode Island. Can you provide more information about your onboarding and your training processes? I think they're worried about maybe they're too remote. I mean, Rhode Island's not really, if they were in, if they were in Ghana or something, maybe it'd be different. But just speak to that.
So we integrate with facilities all over the country, large and small. Like I talked about earlier, we've worked with rural facilities that have never actually built integration. So our integration team actually helps facilities that need that assistance. But we have customers all over the country. So the last I checked, I believe that we can be found in 42 states. So, and Rhode Island is actually one of them. So that's exciting. Let us know. We'll do a demo.
How do you do the implementation piece? Do you assign account managers to take care of the client and they're dedicated, or do they call into a pool of people, or how does that part work?
No. So that's another thing I believe that makes MediMobile stand out is not only do we have 24/7 support, but every customer has a dedicated account manager. And during implementation, you actually also have an implementation manager. So not only do you have an account manager throughout the life of your account, you're never just turned over to support. You have an account manager that you can always reach out to, but also that implementation manager piece is very important because these people are the experts at getting things set up the way that they will work for you initially. So yes, we believe you have to be set up correctly from the start. We want to know what your goals and what your challenges are so we can solve for them and we can meet those goals with you.
Gotcha. All right. I think you may have already answered this one. It says we live in a rural area and our hospital doesn't have full-time IT staff to help with the integrations. How would that be handled?
So we work with everybody's schedules. We've worked with teams we're Central Time. We've worked with teams that are Pacific Time, Eastern Time. So we'll work around people's schedules. But in the event that a team does not know how to set something up, our integrations team is more than happy to help walk another team through that maybe has never done that before.
Okay. All right. This, again, another size one. Our practice has over 500 providers. Can MediMobile support large practices?
Absolutely. We have several very large customers, over 1,000 providers. One thing that I know our team is very proud of, we have onboarded enterprise groups in under 6 months successfully. So when we talk about enterprise, we talk about over 1,000 providers. But that being said, we work with single provider groups. We work with, 20 provider groups, all sizes. And each group is just as important as the next. But to answer that question, we can absolutely handle and work with a group of over 500 providers. And we do it every day.
Great. All right. Let's see if we can squeeze in maybe 2 more and then we'll call it. So this one is, and I think you may have answered this earlier in the presentation, but how does MediMobile keep up with all the ongoing coding changes that take place each year?
So we immediately make those updates to our system when they are rolled out by CMS. But like I said, we know that people are not automatically they haven't completed their billing from the previous day. So we have to account for any back billing. And so what we do for those retired codes is we can put in place a rule that if a provider or a biller or coder actually adds a CPT or diagnosis code that has been retired after that designated date, we can have a rule fire that will tell them that they need to recode the charge due to retirement.
Okay. Well, I think that's most of our list here. Maybe you could just share how they might be able to get a hold of you if they have more questions about MediMobile.
Absolutely. So if you are looking for a demo, feel free to reach out to sales@medimobile.com. Go to our website, www.medimobile.com, and sign up for a demo. We have an amazing sales team that would be happy to help you. And like I said, you'll have a dedicated account manager. And, we thoroughly enjoy working with Unislink. The partnership is amazing. So they are highly recommended for billing. And they definitely know how to get a hold of us.
Well, thank you so much for having us and educating us a little bit about AI. I have pretty much across the board 100% positive reviews from our clients. And the thing that really got my attention was the revenue boost. So anything we can do to help improve our own clients' revenue is welcome in our book. And so I appreciate you educating us a little bit today. And if we get some questions that are afterwards, we'll make sure that we answer those questions for you folks. But thank you so much for being with us and learning from us. And then Lauren, I'm putting you on the hook to do another one for us maybe in the spring.
Absolutely. Absolutely. And we hope that you'll be on ours soon too.
All right. Thank you so much.
Thank you, everybody. Have a great day.
Thank you. Bye-bye.